I think a lot of this is really just words. I think the important thing for South Africans is to know that, around the country, we're seeing again an increase in infections. I think what Shabir is hinting at is that it never completely went away and then reappeared. We've kind of grumbled on. And what we're seeing now, probably because we're moving into the festive season and people are starting to relax and, again, rejoin family, travel, we're just seeing an increase in outbreaks and person-to-person transmission. So, I'm not sure the words are so important. I think what the South Africans have to take home is that we are now seeing an increase in infections around the country. And this is a problem as we move into our festive season.
Yeah, absolutely. And, I wonder, Prof, how much of the period over the past few weeks where we saw many provinces plateauing in the number of new cases that they were reporting, many provinces, in fact, going way, way down in new infections, whether those early celebrations of us getting control of the virus would have impacted us and where we are now.
I think that is right. I think human behavior is what it is. And, it's sometimes hard to keep up what people would think is unnatural behavior, keeping our distance, wearing our masks, making sure we're not going to places we don't essentially have to go to. And I think, maybe we sort of were triumphant too soon. We know the virus hadn't gone away. And it preys on these opportunities where individuals are close to other individuals, where people are not taking the precautions that an aerosol transmitted virus requires. And so we've seen the resurgence almost as predicted, unfortunately. And it does mean we're going to have to double down and, re-look at our behaviors and take those behaviors back on. It's just timing is terrible. But there is, there's no, a virus doesn't pay attention to the calendar. It's doing what it does. And that is, it goes from host to host when it has the opportunity to do that.
Yeah. I mean, the issue that the minister also talked about in that address yesterday was the age group that is now the most affected when it comes to new infections, and that's the age between 15 and 19. It's not, the minister saying that in many, many cases, the vast majority of cases, young people are able to fight off the virus. Many of them will be asymptomatic. But of course, the problem comes in exactly there. The fact that they are asymptomatic, the fact that they are young people, and most likely they are living or in touch with older people.
Yeah, that's the difficulty here. I mean, again, young people will be young people. They by definition, they want to associate with each other. They want to socialize. The problem with this virus is that, of course, they can bring it home. They can bring it home to older folk if they're in contact with people of the next generation. They have the risk of transmitting to that next generation, which becomes a problem because it's the older generation that can't just shrug the virus off, it seems. They are more likely to have more severe symptoms. They're more likely to become diseased and actually end up in hospital. So that's where it becomes problematic. And this is why we have to appeal to everybody across the country, regardless of age, not in a naming and blaming way, but to say, think carefully where you're going. Do you need to go there? And if you go there, what will the aftermath be? If you're coming home to the elderly, you may well bring the virus home, and what might that mean for an elderly person? So until we have the vaccine, I'm afraid we're going to have to hang in there just a little bit longer with our own personal behavior in order to try and mitigate transmission.
Yeah, and I mean, there's also discussion around the vaccine not being the absolute solution to all of our challenges when it comes to COVID-19, even when we do get it here in South Africa. And the issue around a lockdown, of course, Prof, is now again on the agenda. But is that the answer as well? Professor Shabir Madhi as well, who we've spoken to numerous times on this show, saying that actually it's not the answer. It's not the answer to lock down the country again. Actually, the answer is with each and every one of us and how we take care of ourselves, and as a result, take care of each other as well?
I think the South Africans know very well what the lockdown cost us, what it meant for us. It was needed at the time. I think we want to try and avoid it at all costs. So really, I think if the choice is lockdown or changing our personal behaviors, we have to opt for the changing of personal behavior, just because the cost of a lockdown is just way too much. But, I can understand why government is struggling with this decision, because again, if our ICUs fill up, if we start to see mortality rising, that's a really, tough place to be in. So, again, the appeal has to be to each one of us. Let's think carefully about what we do, where we go. It's the simple 3 C's again. Are you going to a crowded environment? Is it a closed space? Are you going to have close encounters? If so, do you need to go?
Yeah.
If you don't need to go, don't do it, and at all times wear a mask. We don't know what the full benefit of a mask is, but there is no harm, and therefore let's do it. We may just save a life, save an infection. It's really worth it. It doesn't cost anything. Let's do it. And then, hopefully we can have a reasonable Christmas time, get beyond this. I actually believe a vaccine is going to be important. I think it will make a difference. We've got to hang in there. It will eventually come. And, we then all need to be in a position to line up, take the vaccine, and then try and get back to some kind of normality. It's tough. The enemy here is a virus. It's not ourselves.
Yeah.
It's not the government. It's not health officials. It's the virus,
absolutely.
and
Prof,
we have to fight it.
Prof, thanks so much for your time this morning on the AM report. And you're absolutely right. That is the appeal that all of us need to take heed to at the moment. Do what you can to protect yourselves, to protect each other. We may well just save a life. Professor Linda Gail Bekker, always a pleasure having you on the show.